Photobiomodulation therapy, formerly known as low-level laser therapy, is the application of light of very specific parameters to tissue where there is degeneration or injury to improve, repair, and reduce inflammation and pain. Photobiomodulation therapy appears too good to be true as it does many things, but it really does just one thing, and it does it very well, and that is it reduces oxidative stress. Oxidative stress is accepted as the underlying trigger for most diseases and degenerative conditions. It is also a component in the inflammatory phase of acute and chronic conditions. Unlike drugs and surgery, photobiomodulation therapy actually promotes regeneration, reduces inflammation and pain, is non-toxic, non-invasive, and has no side effects. Over 400 randomized controlled trials have been published using photobiomodulation therapy devices, and the technology has featured in over 4,000 laboratory studies. Photobiomodulation therapy is used in thousands of clinics, hospitals, and elite sports institutions in over 70 nations. So you're asking yourself, can light really do all of this? Really? Let me take a few moments to explain. The human body consists of 11 systems, each system made up of organs, each organ made up of cells. As a matter of fact, your body has over 37 trillion cells, each individually programmed to perform thousands of functions daily. Every single cell in the body has one component in common, and that component is called the mitochondria. Each cell has hundreds to thousands of mitochondria. The mitochondria is the power plant of the cell, taking the air that we breathe and the food that we eat and combining them to produce the energy your cells need to carry out their daily functions. This cellular energy is called ATP, which stands for adenosine triphosphate. Each cell produces over 10 million ATP molecules every day. This process occurs in a very organized manner in something called the electron transport chain. In the very last step of this chain lies an enzyme called cytochrome C oxidase. It is the receptor site for oxygen from the air that we breathe. When oxygen attaches, ATP is produced, when everything is going well. Now let's talk about when things are not going well. Our cells are exposed to conditions every day that can cause the production of free radicals. This can result from things that are good for us as well as those things that can be bad for us. For example, exercise, our digestive process, chemicals, infectious agents, nutritional imbalances, biological imbalances, and lack of oxygen can all cause the production of free radicals inside our cells. Remember the enzyme cytochrome C oxidase and how oxygen attaches there to produce ATP or cell energy? Well, not only can these free radicals also bind with cytochrome C oxidase, they actually have a higher affinity for that enzyme than oxygen does, attaching there and blocking the oxygen absorption. This decreases the cell's ability to produce ATP in the quantity necessary, the equivalent of not having enough gas in your car to get to work. Well, our cells naturally neutralize these free radicals with rest and antioxidants from our diet. However, when the free radical production is greater than the body can effectively neutralize, a bad thing starts to occur. The cell cannot produce enough ATP necessary to complete its daily functions. This further stresses the cell and triggers a production of an even more damaging free radical called reactive oxygen species. Have you ever seen an apple turn brown after you cut it in half, or a piece of metal rust? This is an example of oxidative stress, or the production of reactive oxygen species. Unresolved oxidative stress is accepted as a key component in the inflammatory phase of acute and chronic injuries, accelerates the aging process, and is the underlying trigger for most diseases and neurodegenerative conditions. These can include disorders such as Parkinson's and multiple sclerosis, even Alzheimer's, gene transcription errors leading to cancer, heart and blood vessel disorders such as heart attack, heart failure, arteriosclerosis, and cardiac ischemia, lung conditions such as emphysema and lung cancer, chronic fatigue syndrome, fibromyalgia, cataracts and vision disorders, inflammatory diseases such as arthritis and inflammatory bowel disease, diabetes, kidney disease, skin lesions caused by sun damage, autoimmune diseases, and the list goes on and on. Wow. So how can light affect all of this? It turns out our cells respond to light just like plants do, very specific colors of light, particularly in the red and near infrared spectrum. Remember the receptor site cytochrome C oxidase and all of those free radicals? Well, cytochrome C oxidase happens to be the absorption site for light in our cells as well. When the light of the correct color and intensity is applied, it immediately displaces the free radicals from cytochrome C oxidase, allowing oxygen to rush back in and resume the process of producing ATP, or cell energy. These free radicals are then absorbed by local blood vessels, resulting in local vasodilation. Together, these steps contribute to the reduction of stress on cells, as well as removing the cause of oxidative stress formation and triggering the cascade of events that stimulate repair. Doesn't it make sense that if we can reduce oxidative stress, increase circulation, increase energy production, and trigger repair all at the cellular level, it would be beneficial for our overall health? Are you now asking yourself, is there proof? Well, in over 400 randomly controlled trials and 4,000 clinical studies, photobiomodulation has demonstrated that the application of light can promote tissue repair, reduce inflammation, and reduce pain. You can also visit our testimonial pages to see real-life outcomes. Better yet, book a visit with our qualified staff, get your questions answered, and experience the benefit of photobiomodulation therapy for yourself.
I started having problems before 2001, which is when I was diagnosed with fibromyalgia. I had so many issues with the fibromyalgia and arthritis that I had to take a disability retirement in 2008. I was only 58 years old. I wasn't ready to retire. So as the time went by, I just kept getting worse. And I have read so many places that once you have one chronic condition, which started with arthritis and of course then was closely followed by the fibromyalgia, you are susceptible to others. The pain, of course, being the worst. I knew, my soul recognized this as a technology that was going to play a part in my life. And sure enough, about a year later, Valerie called all excited about the Novothor light bed. And she got me over there to try it, and I became a believer. The pain stopped in the feet, and then it stopped in the hands, and then it started slowing down in the low back and in the neck. Also, the fatigue was not as heavy, as depressing. And speaking of depression, when you have all of these issues going on, it tends to work on your psyche. So I wasn't as positive and as happy as I had usually been. Pain can knock you flat. Fatigue will take you the rest of the way. But the light bed was like being put into the hands of God. It just felt so good. It gave me back a life. It wasn't my normal life I had before fibro, but any life that was available better than what I had was so gratefully appreciated. And it did give me that. I absolutely came alive from being in the bed. It gave me more energy. It took away a lot of the pain. And from that, I was able to go back to laughing and finding the positive things in life. And simple things for people in my condition are so enjoyed and appreciated. And I have a grateful list now that I go through every day, and the Novothor bed is definitely on the top of the list.
My name is Aaron Nelson. I'm the VP of Athlete Care and Head Athletic Trainer for the Phoenix Suns. I have 3 other assistants that work with me from injury prevention, treatments, performance, recovery. We cover it all. Over the years, technology's changed dramatically, and I expect it to continue to change. And I think the important thing from my standpoint or my position is to what is that change, what works and what doesn't work. When I'm looking for something new and innovative, I want to make sure that the research is pretty sound behind it. It's hit or miss, but I think the important thing is finding what works. Novothor is a very interesting piece of equipment, and what it is a red and near infrared light, which is low-level light therapy. Now it's called photobiomodulation therapy. It's non-toxic, it's non-invasive. There are really no contraindications to it. It has a systemic value to it, which means the whole body is getting introduced to the light. See, it's big for pain and inflammation. We've had players post-surgical that we want to try to speed up the healing process. We actually had a player with back surgery that came back, that was probably back a couple weeks faster than normal. And just in general for performance, we'll try for a week where we do 3 to 5 sessions just as a recovery because their body's tired, they're a little bit sore in general, not necessarily hurt, but we'll go up and get in the bed for 15 minutes and then come back down. With a Novothor bed, we can actually take advantage of 15 minutes of the red and infrared light that their body's gonna absorb and help them throughout their whole body, not just an individual area, hopefully increase their metabolism and their energy level. Put our players in it, but then you can also get the general clientele. I could get in there, you could get in there, anybody could get in there and utilize it for lots of different functions. For the weekend warrior or for someone just suffering from back pain. There's a lot of different reasons to get in and use it. Novothor bed hasn't been out very long, but the people that have used it, it's been amazing, the feedback. Some people describe it as life-changing because they can barely get up in the morning because their back's so sore, their knees are stiff, to people setting personal PRs in the triathlon. So again, you're looking at both ends of the spectrum for the person that's just going in and working their job and just their body doesn't feel good or there's issues going on, to an elite athlete that's every night trying to give it all on the court. A very unique thing that our players use that now anybody else could use here because we have access to it. That's a huge plus to be able to come in and utilize something like that.
The history of light therapy has come through mostly pain management and musculoskeletal, but the real benefit to light is the stimulation of repair at the cellular level, and that's low intensity light. This is the first full body device that's been built with the correct parameters and dosing because it's a dose dependent technology. In the past, the spot therapy devices have been used to deliver light to local areas. So in the sports industry, joints, tendinopathies, reducing injury or shortening that recovery time and managing pain. Now that we have a full body device, you can actually put somebody in for 12 to 20 minutes and they get the advantage of reduction of inflammation at the cellular level in every cell that it touches. So if you pre-treat with light, you can expect a shorter recovery time, and because the cells are recovering more quickly, it's not that it's making you stronger, it's allowing you to recover more quickly so you can train harder, and that's where we're seeing the benefits. So what we're seeing typically is in as little as 2 weeks, 2 to 3 sessions per week, we're seeing significant increases in PRs. For example, we have a strength coach out of SMU that used the light bed 3 times a week for 4 weeks. He had a lifetime PR of 550 pounds in the deadlift. At the end of the 4 weeks, he had a new PR of 605, so a 55-pound increase in just 4 weeks of application. It seems a little bit too good to be true because how can one thing do everything? It doesn't do everything. It does one thing very well, and that's it reduces oxidative stress.
My name is Dennis Mitchell. I am the head coach of Star Athletics Track Club International.
I am Justin Gatlin.
My name is Mira Lahore.
My name is Kayla Whitney.
So far, I've been on 3 Olympic teams. I've been in the Athens 2004, 2012 London, and now also 2016 Rio.
I was approached by Nike with a shoe contract, and I became one of the youngest athletes ever to sign professionally with Nike.
I am a 4-time silver medalist in the 100, 200, and 60 meters, and also a 2-time Olympian.
We were first introduced to Novothor at the 2016 Olympic trials. Alberto Salazar had a unit at his house. He offered Justin the ability to use the Novothor bed that he personally had to help him get through the rounds.
And it was crunch time, and I'm running with an ace bandage on. And Dennis comes to me and he says, look, we're gonna go over here, we're gonna try this Novothor out. And I literally did it maybe the day before, because sometimes athletes are really skeptical about doing things the day of their meet and they don't wanna break routine. And I remember getting off the bed and I felt so rejuvenated. I just felt like my cells were just popping like popcorn. And I told Dennis, like, all right, we got to go over there before before the finals of the 200. So we went there the day of the race. So the next day we went there again. I got a Novothor treatment, and I felt great. I went out there. The odds were against me. I was running in lane 8, so I was running blind, and I was still up in the air about this nagging injury I had, and I went out there and ran one of the fastest times in the world at that point in time to make the Olympic team.
The difference between him one day to the next day using the Novothor bed was like night and day. And we knew he had a really big race, and his competitor, which was a Nike athlete too, was also using the bed. So we kind of had a little, hey, you can't get it better than I can kind of thing. And Justin ended up squeezing him out by a couple of hundredths of a second to make the Olympic team and win the Olympic trials. So at that point, we were sold on Novothor.
Training became like super easy. Like I would barely feel lactic acid in my workouts. I'd recover day to day, like astronomically better from years past.
I had a guy that hurt his hamstring on a Tuesday and ran track meet on Saturday. That's how confident we are with the recovery aspects of the Novothor.
Ever since I've used Novothor, I've noticed like, my lactic acid levels have lowered tremendously. My recovery time has been cut down almost in half.
I started seeing that our athletes were not deteriorating in their energy as fast throughout a week. So I found that when they came in to practice on Monday, they still had that same level of energy when they left practice on Friday.
Novothor is a very important tool for not only training-wise, but my recovery. And, as you become an older athlete, recovery is equal to training. I got to go out there and I got to execute not only in races, but at practice, because that's where you're going to really find who you are before you get to the line. And I have to be recovered to be able to do so.
Any injury we have, we just implement this into the protocol that we usually do, and it's just sped up healing processes of everything.
I don't have to decrease my volume throughout the week. I can kind of maintain the volume that I can, and that gives me a lot of flexibility to be able to increase the amount of speed work they have, the amount of, I guess in sprinting you can call it distance work, and the amount of quality that we can put into our training philosophy.
It has sustained me, has made my career longer, where I thought maybe it would be shorter.
Now these athletes are, they're going in the mornings, they're going, after practice. They just really love it because they feel, energized, and the bed actually relaxes them while they're on there, which is something that they can't typically do on their own because their nervous systems are charged.
I feel like I'm literally tanning on the beach in Monaco. It's so soothing, so relaxing. I feel like I'm just warm and cozy, and it's great.
Where would I be at if I didn't have Novothor in my life? I would probably be somewhere sitting in a broadcasting chair, or with a stopwatch around my neck, or a whistle, or coaching.
And one of the other things that we've connected on is NormaTec, compression therapy.
Yes. They used to say the limb system doesn't have a pump, but we all know movement is the biggest pump for the limb system. And to be able to systematically move that lymph in your system, which is the sewage system of the body, to get out the waste, to get out the lactic acid and so forth, it's wonderful to put new things in. But if you don't get the poison out, it's like taking a gas tank and you throw mud in it, and then we're going to throw the best fuel on top of that. If you don't get the mud out, if you get the dirt out, the fuel's not going to work properly. But I love it, and I'll just flip on the news or flip on something in the background or some audio or whatever and just space out for that short time, but you feel a gigantic difference.
Life for me before he started a treatment was very, very stressful. It was unbelievable. He used to wander. He would go through cupboards. He would, it was just, and he would have temper tantrums, and it was very, very, very difficult. It was very stressful.
Yeah. That's it.
Yeah, it's better now, right?
Yes.
Yeah, it's better.
Yes.
Yeah, much better, right?
Much better.
I'm gonna tear up now because it was so awful before.
Yeah, I guess. Yeah.
It seems with dementia you don't see I guess you see everything right, but you don't feel everything right.
This study that we're involved in is a feasibility study, so it's relatively small, but it is a randomized controlled study.
With the treatment, I feel a lot brighter. Nothing's dull anymore. I can look around and nothing's dull.
It was a complete change. He became calm. He stopped wandering. He was able to sleep at night, and he stopped searching for everything.
Essentially what we're doing is evaluating the patients at 3 points. Baseline, where are they before they start treatment? Halfway through treatment at 6 weeks, and that at completion of treatment at 12 weeks.
And then she told me that I had to give it up.
With this going on, photobiomodulation has been experimentally and practically shown to make a healing difference in the immune system, the vascular system, endocrine system, where the hormones are controlled, and of course, the brain. Let's now take a look at a difficult condition like Alzheimer's disease. In Alzheimer's disease, we lose cognitive functions because the disease significantly shrinks the brain over time. This we know.
There is no consensus on how Alzheimer's disease is developed. The most widely followed is the amyloid hypothesis, which proposes that beta amyloid is the primary causative agent for Alzheimer's disease. These plaques are toxic to brain tissues. Many critics believe that it is merely a biomarker that is created by the disease. Other hypotheses include those that relate to the deficiency of the neurotransmitter acetylcholine, the tau protein abnormalities which lead to the formation of neurofibrillary tangles, oxidative stress on the mitochondria, intake of metals such as aluminum and copper, herpes simplex virus, environmental pollution, myelin sheath breakdown, and a few more. For someone who has already developed the disease, the best that existing pharmaceuticals can offer is to temporarily restore cognitive function, usually for about 6 months to a year. This is not a reversal. There is still nothing on the horizon for the estimated 40 million people around the world who've been diagnosed as having Alzheimer's disease or alternative forms of dementia.
Now what if we just forget about being fixated with trying to attack the biomarkers and symptoms and just trust the body's intelligent response when we help it by directing near-infrared light to the neurons? So let's actually look at the science related to photobiomodulation, specifically relating to the brain and Alzheimer's disease. I have already explained that cells are able to harness light energy for survival and propagation. And neurons are just another form of cells, complete with the necessary structures that enable them to do the same.
Impaired neurons respond positively to near-infrared light. There are several published studies that demonstrate that damaged neurons restore their structures after irradiation with red and near-infrared light. Not just on cells in experiments, but also on laboratory rats with Alzheimer's disease. Neurons damaged by oxidative stress, which is the basis of one of the hypothesized causes of Alzheimer's disease, has also been found to recover in a similar fashion after irradiation with near-infrared light. Now, if you subscribe to the amyloid hypothesis, this therapy does indeed reduce amyloid beta protein as well as the precursors. It mitigates the damage of the disease and improves cognitive functions.
There have been a range of studies carried out with directing light to the brain in the form of transcranial photobiomodulation.
Researchers at the University of California, San Francisco just discovered that stem cells become neurons in the presence of persistent light energy. This is the basis to hypothesize that if stem cells are present in the brain, the regular presence of light energy in the brain could result in new neurons.
I'm a physical therapist, and I'm a certified athletic trainer and a strength and conditioning coach. I've been involved in sports medicine as a student athletic trainer dating back to when I was in high school. So I've been involved in this field for over 40 years. And after physical therapy school, was involved with intercollegiate, high school, and the professional level, in addition to the Olympic experience that I've had. So being with the Celtics, going into my 29th year, the roles have obviously changed, and because of the experience that I have and some of the different degrees that I have, having my doctorate in physical therapy, it's important with some of the research that's out there, and so that what we're applying is evidence-based practice, and we're not just doing anything because a player happens to like it. And that's where NormaTec comes in also as an example, that they have the science behind it and they continue to do research. Intermittent compression units have been around for many years. NormaTec, a local company, came in with a new unit for us to try many years ago, and I say many, probably about 5 or 6 years ago. So it was fortunate for us that they were here. We were able to utilize them, and their units they have segmental units, okay, on the same appliance as opposed to the whole appliance inflating all at once. Over the course of time, the field of sports medicine, athletic training has expanded into different areas. Years ago, the athletic trainer was also involved, say, in developing strength and conditioning aspect. So one of the things, so with the evolution of sports, things have become more specialized. So one of the things that over the course of time that you've seen is that regeneration and recovery is another component, another sphere that we need to evolve into also. So in addition to nutrition, in addition to conditioning, in addition to the immediate management of injuries and their rehabilitation aspect of it also, recovery and regeneration are a big aspect of what we need to do, and especially in a sport like ours where we have a compressed schedule of 82 games and somewhere in the vicinity of about 170 days. So that's important for us. Within the recovery room, and we set this up, there are many aspects to it. And for recovery and regeneration, warm whirlpools, cold whirlpools, biofeedback units, lower your heart rate down. We also have a full-time massage therapist, and we've had that for years. So as an adjunct to that is the use of the intermittent compression units that NormaTec provides, and it's been a great facility for us to build this out to separate the players away from the hustle bustle of the locker room, the court, the training room. So mentally they can decompress in here, but also physiologically when we're working with the different modalities to help with recovery and regeneration. It's difficult to play 4 games in 5 nights. It's difficult to play 5 games in 8 nights. So we have to look at every different area that we can. That's why we look at nutrition, rest, massage, biofeedback units in order to do that. And with this NormaTec in here, it's been well received. We keep track, obviously, as anybody would, of the use of modalities, our treatments that we do, and we saw a spike and an increase once this room was created. The other aspect that, using NormaTec as an example with their intermittent compression unit, is that it can be used for recovery, but also post an acute injury, post-surgery, in order to decrease edema, swelling, within a particular joint. There are garments for your lower extremity, there are garments for your hip, garments for your upper extremity. So we will utilize it that way. The advantage of, say, with the NormaTec is there are different settings that you can put on the unit itself, so that we can progress from a light compression to an increased intensity. We can change the time. It's very flexible in that aspect. And what will happen is that over the course of the first 2 minutes, it'll set itself, and then the units will segmentally fill up. And it'll go through a cycle with the goal of pushing the fluids, pushing blood, recovery, also that peristaltic sensation, giving a little bit of a massaging effect to the athlete. The units are small enough to also travel with, which is a great advantage for us. Whether it's in my hotel room or the player's hotel room or on the plane also. That's a battery-operated unit that just needs to be recharged instead of having to be plugged in all the time, which is super. Now that's been an advancement within the company, which is nice. So the company just isn't static. We're always looking to either improve the unit or do the research to support what they've done and why they're selling it. One of the advantages that this unit provides is I'm able to customize it to each player. Okay, so that when they come in on a particular day, I'm able to either increase the intensity, lower the intensity, or I'm able to also change the time I'm able to only use it on a certain part of the body. So if I had a leg unit on, I might only want the foot and the ankle for an acute injury. I can also program it just for that. Or I can program it to have, say, all 5 segments of use. Or within there, if I need an increased compression in a particular area, I'm able to program that and get a little boost in just that area also. The other advantage on this is also that you can just have, there are 2, at this Y junction, there are 2 coming off, but by just flipping a switch down here, you can only have to say, maybe only have to use just 1 leg, okay, and 1 appliance, which is a great advantage in the rehab situation. Recognizing the need several years ago, for that, that athlete, not only for return to play, but as been described, what's the best ability is availability. So within the course of the season, as your body begins to break down, we need to push that threshold a little bit higher, okay, of when will that individual need to, rest before fatigue sets in and deconditioning sets in. So a few years ago, we dedicated, an area, and then with the introduction of NormaTec, the ability of the team stepping up and buying a cold whirlpool and a warm whirlpool for immersion, we encompassed it all into one area. So there was a great advantage to that. We were one of the first, if not the first, to dedicate in the NBA to dedicate a separate room to that. And the field is just going to expand as research, evolves, and that we look at different areas, whether it's with biomarkers, whether it's with biometrics and tracking them out on the floor when we have to adjust their workloads and joint loads. That's one aspect of it. The modalities that you have to use are another aspect of it. So there's the prevention of it, there's the management of it, and it's been a great component so that when our players are out there, we're trying to put the best athlete at his peak at that particular time out there that he can.
Hey friends, I'm Jorge. I'm the exercise and nutrition counselor here at Dr. Sierra de Aragon's office. My goal being here is to help you use your lifestyle as a tool for health and high quality of life. Many chronic diseases such as diabetes, hypertension, obesity, arthritis, hormone imbalances, chronic pain and fatigue can all be taken care of through your lifestyle, your decisions. Here, we exercise, we lift weights to get strong, we do body weight calisthenics in order to move better, and we do cardio so you have long-lasting energy throughout the whole day. Of course, we take care of recovery by stretching, foam rolling, using mindful breathing techniques, as well as the best technology, the Novothor light therapy, cryotherapy, and NormaTec compression therapy. Also, you'll learn how to eat healthy, balanced meals without feeling deprived. Through these simple solutions and your disciplined choices at every meal, you're going to lose weight, have more energy, and be healthy. Now, most importantly, and certainly my favorite, is the mindset that we teach. You embark on a life journey, and in that way, you become the person who gained their health by taking control of their lifestyle. Thanks for watching this video. I'm excited to meet you soon.